Here is your stem.
Yes, ma'am, I'm ready.
Okay, so if you've read and understood, considering it surgical anatomy section, please identify what exactly, which bone is this, and which view are you looking at?
Sorry, ma'am. Which bone is this?
Yes, what exactly are you looking at?
This is skull bone, base of the skull.
Base of the skull. Okay. Would you be able to identify the fossas in the posterior cranial fossa, or tell me the boundaries of the posterior cranial fossa?
Posterior cranial fossa, anteriorly, dorsum sella, and
No,
posterior.
entirely. This is posterior cranial fossa. So have a look. And posteriorly,
Petrous
okay.
part of
Petrous.
the temporal bone.
Yes, and what is number 4?
And number 4, cleavus.
Yes. So have a look and identify and tell me, please. And
So anteriorly, cleavus, posteriorly, the temporal bone,
no,
and
posteriorly what? Please.
ma'am, laterally, petrous part of the temporal bone,
Okay,
and
laterally, squamous, and
posteriorly,
wait,
yes,
it's not just, but have a look, please focus, and then tell. Just don't memorize, because laterally it's squamous and mastoid parts of the temporal bone, and then posteriorly,
occipital,
yes, and superiorly.
superiorly, cleavus.
Clevis is in here in front of you. It's anterior.
Yes, ma'am.
So what is superior and
Anterior,
what is this is inferior? What is this? Number 11. Please identify.
foramen magnum.
Okay. And what is in on superior on top of it?
Um, on
Okay.
top of it,
Tentorium cerebelli. What
tension,
okay, what are the bones which form the posterior cranial fossa?
temporal bone, occipital bone, and temporal and occipital,
And parietal. See?
and
3.
parietal.
Yes. Okay, please tell me which venous sinuses tracts are present in the posterior cranial fossa.
Venous sinus, transverse sinus, and occipital sinus,
See, you
and
got, I'm sorry to interrupt you, you got 3 days to prepare it really well. So if you could classify them into paired and unpaired, and then tell me the paired ones first and then in unpaired one, maybe you can explain it nicely and neatly.
pairs are transverse sinus, and superior petrosal sinus and inferior petrosal sinus,
Yes?
and third occipital sinus, and a straight sinus, and superior sagittal sinus.
Where exactly this straight sinus is found?
Straight sinus, I'm from 29, the occipital protuberance here.
Okay. Basically, in the superior border of tentorum cerebelli. What is tentorum cerebelli?
Tentorium cerebelli is a fold of the dura mater, and superiorly, uh, uh, tentorium cerebelli and border anteriorly sphenoid bone, and posteriorly uh, posteriorly occipital bone, and lateral petrous part of the temporal bone.
Would you be able to tell me what structures passes through number 11?
Spinal cord
And
and lower border, lower end of the medulla,
anything else?
and spinal artery and vertebral artery enters into the skull through foramen magnum.
Okay, please tell me what is cavernous sinus?
Cavernous sinus is present on both sides of the scala turcica and carries blood from the ophthalmic artery, facial ophthalmic vein, facial vein, and it drains blood to uh, uh, superior petrosal sinus and inferior petrosal sinus, then to the sigmoid sinus to jugular vein.
Okay, how would the patient present if a patient is suffering from cavernous sinus thrombosis?
Painful proptosis and paralysis of the third, fourth, and sixth cranial nerve, and uh, signs of meningeal irritation and gradual loss of vision.
Okay. Okay, would you be please able to identify number 30? Because we are just focusing on the posterior cranial fossa at the moment. So if you could please
And this is
identify.
a jugular foramen.
Okay, please tell me the contents of it.
And anteriorly inferior petrosal sinus, intermediate 9, 10, and 11 cranial nerve, and posteriorly sigmoid sinus.
Continuation of sigmoid sinus, which is internal jugular vein, because that's why the name comes from, you know. Okay.
Yes, ma'am.
All right. Please tell me what is clevis. Number 4, we identified it. If I ask you to define it, how would you define it?
Ma'am, I don't know the definition.
All right. Okay. If you could tell me, right, what more structures? All right. You could identify. What are these 44? These markings you could identify. Okay. Would you be
This
able to
is
identify 27?
yes, hypoglossal canal
Okay. What passes
27.
through it?
Hypoglossal canal.
Yes,
Ma'am,
it is
hypoglossal
hypoglossal canal,
nerve.
but what passes through it?
I'm not sure. I cannot remember
Okay,
this now.
would you
But
be able to tell me very quickly what this 29 is?
is pterion,
Yes, please tell me which bones form pterion?
frontal, parietal, temporal, and sphenoid bone.
Frontal, parietal, sphenoid, and
Laser
temporal.
wings of sphenoid.
Okay, please, what is the clinical significance of this point?
Middle meningeal artery runs under pterion, so injury here may lead to uh, a middle meningeal artery uh, bleeding.
Thank you.